I want to introduce you to a few folks. So first up is Symplr's head of market intelligence, competitive intelligence. He's a bit of a numbers guy, loves data, and is generally nerding out on a session like this, and that's Todd Jones.
Hello. Hi, everybody. Yes, data guy, frightened to be in front of you, of course. No, just kidding, but we should have a great session.
You're doing great. Okay, so that's Todd, and we're going to be asking some questions. We're going to be showing some data. Joanne Skaggs. And Joanne, will you introduce yourself and say a little bit about you?
Hi, I'm Joanne. This is the fun session. Glad y'all hung out for it. I identify as a clinical leader, so I'm with my people group right here. Thanks for letting me be here.
Awesome. Thank you. We've got Chris floating around over here.
Hey everybody, I'm Chris Sosinski, Vice President of IT Applications for Advocate Health. I lead the ERP ecosystem and the Workforce Management Platform ecosystem here with Amy Olson, partners in crime at Advocate. I'm representing the IT executive table. We only have one table, I think, just one.
Well, you kind of are bleeding on that.
Oh, we are. Oh, there's more of us. Okay.
They're lurking.
There's always more IT people who look around.
And then we've got Terry.
Hi, everyone. I'm Terry Hanlon-Bremer, Chief Operating Officer at TriHealth in Cincinnati, and I get the task of having footsteps that go with the admin team over there and the ops team over here.
And here's what we're going to do. We're going to have a little bit of fun this afternoon. So we've divided you into 4 groups. Well, 5 in this room. That's okay. So we've got clinical, we've got IT, we've got people, and then we've got admin and operational. And again, for the purposes of our survey, the way we grouped you coming in here, we looked at operational and admin together. So you're going to see some of that data showing up. What we're going to do today, we're going to go through some underpinning market themes, just kind of, lay the groundwork here. And then we're going to discuss topics at your tables, so amongst yourselves. But to make this a little more fun than just talking about the topics, after you're done discussing the topic, we're gonna ask you a question. It's the same question you answered on the pre-event survey. You're gonna discuss it, and then we're actually gonna survey you in the room right now, so you don't actually have to agree with everybody around you. You can have your own opinion. You can just go off the reservation, and we'll show what that looks like as well. So it's kind of a fun. It's perfect for popcorn. You can sit back. You can just wax poetic, offer your opinions, and then kind of vote however you like. It's a little bit like America, actually, but it'll be good. And so at the end of all this, I'm just kidding. I'm just adding a little bit of fun, sprinkling it in. I know, those of you who don't know me, I am a little Canadian too. So at the end of all this, though, you're going to have some insights into how each other are thinking. Maybe how the clinical group thinks about things, maybe differently or the same as our IT group, as our operational executives. And we'll go from that. The people we introduced you to before already know the questions, and so they're thinking about that a little bit as well. So they're going to help kind of guide some of these conversations as we go. 3 big topics we're going to talk about. Identifying top challenges. What are the biggest challenges that you're faced with? Minimizing operational complexity. What does that look like? How do we do it? What are the priorities there? And harnessing the power of AI. Those will be some of the conversations we have. And the questions that we're going to ask will be in the menti.com. That's the QR code right there. And so we'll be asking questions when it's polling time. So if you want to right now, you can scan that QR code just to start getting into that application. So you will need your phones for this exercise. We've talked about some of the trends that we're all facing: tariffs, pricing increases, challenges with federal budget, $880 billion in proposed cuts, AI budgets outpacing IT spend. I'm just setting this here as trends and themes for you to think about while you're having these conversations. Thinking through things like volumes remaining strong, including emergency. Outpatient revenue has slowed as inpatient revenue grows. Expenses continue to rise. Market trends, market themes, just to back up those conversations you all are having.
Okay. So we're going to start off, come full circle to where BJ started us off with top challenges that you're facing as organizations. And we've hit a lot of this today. We've talked a lot about tariffs. This data point you see here is a predicted 10% increase in supply chain costs from healthcare leaders when it was surveyed back in February. We've come many moons in executive orders since then. So, plus we have the Medicaid cuts, proposed NIH funding cuts. So lots of uncertainty swirling in the federal environment. But even with all this stuff being pushed down from DC, that doesn't mean some of these systemic vulnerabilities, right, that have occurred within health systems aren't still occurring. So just a couple of data points, cybersecurity and RN turnover. 2 years ago when we did our symplr Compass survey, we asked IT leaders and only 5% said that cybersecurity was their top concern. Last year, on the heels of the Change Healthcare attack and many other cyber attacks, that increased to a whopping 40%. Similarly, yes, vacancy rates and turnover rates among RNs are coming down, but that doesn't mean we, of course, don't still have a persistent labor shortage in the market. And to back that up a little bit, NSI did their annual staffing report and calculated that the average hospital loses about $5 million a year due to turnover. So that's some market context. And now we're going to set you guys up for that first question. And you should see it pop up. Which is the top operational challenge your organization faces today? Select one. You're going to talk about what did you answer? Why did you answer the way you did? How does it differ from some of your colleagues? Is there debate? What informs your answer? And then we're going to come back as a group and talk about it a little bit. And we're going to lead off with the administrative group and Terry when we do come back together as a group. So talk amongst yourselves, 8 minutes. We're going to have some groovy music playing while you do that.
How did it go? What did we learn? We've got our operational excellence team kind of at the ready. Terry, some insights.
I will tee it up going between 4 tables, but I would ask any colleagues to jump in on anything I missed because I did not hear the full discussion. But what came out was 2 pretty strong themes. One is, as the top challenge, is really around finances. That was pretty strong across all the tables. And the other one was fragmented processes and technology. Just talking about the fact that that's where inefficiency resides, and if we can resolve that, it would hopefully make the finances a little better. What I also heard was around the aging population and the impact of that on the systems, as well as the loss of workforce that'll leave, that retires out, and where the role of AI or technology can help play, especially as you have inexperienced team members or nurses or staff, and how you can get them skilled up. So let me pause and just look around and see what else somebody wants to add to this. Or my friends over on the other side there, anything you all want to add?
So the number 1, number 2, what was your number 1? I'm just curious.
I think it's
kind of from the challenge. Financial. Anybody in the whole room have anything different than financial? Any other challenge that wasn't financial right now? Yeah? Clinical group nodding over here. What do you got?
Fragmented processes and technology.
Fragmented processes in technology. Okay, cool. And we got HR, people, executives evenly split.
Well, we were evenly split with staffing. So financial and staffing because they're interdependent. And we think that if you solve the staffing problem, then you can help alleviate some of the financial pressure.
Got it. Okay. Let's see how that compares to where we were before we got in here and where we are right now.
So runaway favorite, financial pressure, no big shocker here.
And this was, and just to be clear,
sorry.
this was pre-event. So pre-event, we asked you all kind of help us understand what are your top operational challenges that your organization faces. So 44% of you, not half, 44% said financial pressure, which is interesting because today I'm hearing like pretty widespread agreement on financial pressure. We didn't exactly know what group you were in beforehand. So let's see how that compares to now, today in the room. So same question, which of the following top operational challenges does your organization face today? And what you can see here is financial pressure and the number of people. So administrative leaders far and away said financial pressure, although a few called out fragmented processes and technology. We had a lot of our clinical leaders agreeing financial pressure. although a few of our clinical leaders called out staffing shortages and burnout. IT and administrative, same thing, although actually our administrative leaders, like we already called out, sort of noted that fragmented processes. And then we have all the folks who were just, we don't know who they are. And those are people who, all good, missed the first question, not a problem. And so in our little Menti survey, we're going to have some unknown people answering our questions. And those are literally, you just missed the first question, but don't feel bad. All good. So by far, financial pressure leading the group here, and no surprise probably in this current market. Let's go to the next question.
All right. Next up, minimizing operational complexity. And we're going to look at this through the lens of when you're consolidating around particular vendors, what do you look for when you're looking to consolidate? 150 average solutions that people use for healthcare operations. And that's just healthcare operations, and that's probably very conservative, right, as BJ discussed earlier. And then in that same symplr Compass survey, 80% of the folks, or the IT leaders, said that yes, there is an opportunity to consolidate these types of solutions. And in part, what that leads to is what we see here in the middle. Clinicians report wasting more than 1 hour a day, 85% of folks, and that was another one that BJ mentioned, which adds up to a full day. Lots of time to be won back through this. So with that context, we're going to go to our second question. What key factors do you prioritize when selecting healthcare software vendors for consolidation? And you can choose up to 3.
We're going to move to our next slide in just a minute, and then we're going to come back and we'll bring this QR code back up. So don't feel bad if you missed it. But what we're going to do, the same exercise we just did. We're going to have you in your groups talking about key factors you prioritize when selecting healthcare software vendors. And if we go to the next slide now, the various answers that you can select from on the app, but also for discussion in your group, are all up here. Same deal as last time. It's 8 minutes. And then Chris is going to help lead us in the discussion as we wrap up this question. So right now, you're on the clock. 8 minutes. Off you go. Let's see. Everybody got to talk a little bit about key factors prioritized when selecting healthcare software vendors for consolidation. And we thought we'd bring in the big guns, an IT guy. Probably doesn't like to be called an IT guy, but we got Chris over here. He's going to talk to us a little bit about how you guys thought about this question.
Yeah, so we all agreed number one is certainly cybersecurity top of mind, but it's almost table stakes. They have to have this in play. But when you look down the list, the next thing was really roadmaps. As we think about investing more in platforms, you're making a long-term bet. It's a big deal to move to a platform, but you plan to be there for a long, long time. So what is that vendor's roadmap for the future? And what influence do you as a client have on that future roadmap to blossom that partnership? And then we talked a lot about functionality, almost being more important than UI. It's about the features and functions of the product. And if it's a SaaS product and new features continually to be released, those things are good. Those are benefits. Those are things you're placing bets on as you go. We talked about scalability as well from 2 perspectives. One, is the vendor's product scalable to your size, to your scope, to your data as part of that platform strategy? But also, is the vendor's operational business model scalable? Are they small? Are they nimble enough to be around long term? As you think about what that looks like in the next few years. So that's a risk you have to weigh as you think about the vendors you're going to partner with, whether they're big or they're small, whether they've been around for 10 years or only a few months. Any other comments you guys wanted to add?
What about anyone else in the room? Any other thoughts?
I'm dying laughing because the clinical teams over here were like, literally the commentary was this.
Now we know why we have a hard time communicating with IT.
Literally. I looked over at the clinical team and they were like, roadmap, what? I don't even know what that is. So
Yeah, we know. Meet us at the bar. Meet us at the bar in 30 minutes. We'll give you the crash course.
this is why we all work together.
Right.
That's awesome. And we've got our competitive HR team over here. Did you guys who actually did stop me and say, hey, is there a prize? just in general for this whole session. You guys have anything to add?
Oh, yeah. First of all, there were too many options. We all agreed. That was something we all agreed. But we sort of boiled it down to user experience and functionality, which we, again, tied. We were split. But we felt like, again, those were interconnected. So you just really can't have a good user experience if the functionality doesn't work. And then I was going to say, the one thing that we did not see on this list was efficiency. So, which is the question I would ask is, where is efficiency in the play? Because we think it should be in the play.
Good to know. Add efficiency to the list. And the operational leaders got anything else over there in the back corner of the room? All buttoned up?
Well, there was just one comment at this table around the fact of other equals cost, just making sure that the cost, so we've got financial pressures, that we're thinking about cost.
I love that. And our administrative leaders over here, you guys have anything else to add? Did we catch it all? Cool. I'm taking that as a big fat yes. We got it. Okay. Let's see how we voted.
Pre-event interoperability. Didn't hear anybody mention interoperability. User experience and functionality, definitely, we've talked about. I was kind of surprised in these results to see cybersecurity down a little lower. Now let's take a look at how you guys voted today. Similar, pretty spread out. User experience, you look in the lead, interoperability, functionality.
So the clinical people put user experience very high. Our conversation at our table is that unless it's absolutely egregious, and very few vendors at this point have egregious user interfaces, it's about the process, and it's about the process engineering. It's just a different perspective. I'm not saying we're right, but I'm just saying clearly there's a gulf there, right? Because we're saying doesn't matter, it's good enough, and you're saying it's everything.
This is we could literally just have a conference on this. Interoperability, clinical leaders just really prioritizing. The conversation's still going on.
Yeah.
It's like, get your dukes out, man. Okay, interoperability, top of the list. User experience, important for clinicians. Things like functionality, HR leaders really driving on that. We've got cybersecurity, top of mind for our administrative leaders. And that relationship, the breadth of solutions, but the relationship being really important for our IT team, along with the roadmap. So what an interesting set of results, I have to say, and an interesting conversation in here.
That's part of the beauty of this session, right, is to kind of see what some of those differences are and, have that conversation. Talk amongst yourselves. Okay, going on to the next one. Harnessing the power of AI. Wouldn't be a conference if we didn't talk a lot about AI. All these numbers, or at least the first two, come from a new report from Bessemer Venture Partners. It's called the AI Adoption Index Report. They did it in conjunction with Bain and AWS. Lots of cool stuff in there. They look at a lot of different use cases and index them, and it's pretty cool. So no surprise here. 95% of the people that they surveyed thought Gen A will transform the industry's revenue, costs, or admin burden, but only 50% of the healthcare organizations that they surveyed have a distinct plan, right? So it's a very fluid space, lots to be worked on there. And then last this is from the American Nurses Foundation. 60% of the nurses surveyed there listed accuracy as their top concern for AI. So with that context, what is your top concern related to adopting new AI technology? We're back to the select one.
So the question here, what is your top concern related to adopting new AI technology? Cybersecurity, lack of resources, expertise, lack of transparency with the model and training data, model accuracy, model fairness, bias, regulatory and legal considerations, or if we missed one, call it out at your table. Okie doke, talk amongst yourselves. This is our final question, and we wanted to understand what is your top concern related to adopting new AI technology. And so Joanne is going to kind of lead us through this discussion. Joanne, what do the clinical team think?
Yeah, so the clinical team brought up the whole and model and training data. So both tables actually brought this up pretty extensively. And so actually we have a use case where they actually had some clinical data around a whole ICU, particular AI, but it hadn't been actually studied in the ICU. It was studied in walkie-talkie kind of patients. And so the training wasn't actually for that patient group. And so the question really was, how do you make sure that you have full disclosure around the training model and training data so that it applies to your patient population? And then this group brought up the same exact sort of question mark because you want to make sure it's very accurate from a clinical standpoint. And the second part was really an other box, which they brought up around confidential protected health information and making sure that that stays protected.
Outstanding. Terrific. Did anybody have any other discussions? Anything else that rose to the top of your priority list?
As an IT table, I think we feel like AI needs to be much better defined. There's different kinds of AI. We need to understand it, what we're trying to solve. We need to look at the problem from a different perspective. We also need to hire people in-house who have an understanding of AI philosophically. So we can rely on vendors to do the great things you guys do and take that when it's ready. But we need to educate our own teams on what AI really means so that we feel safe about how we're approaching those problems.
We were just talking about inherent bias too, is a concern. And there's a couple of examples about that. She had a really good one about child abuse.
Health equity, basically, and the concern that there would be an inherent bias within the AI in the data sets that are being utilized and how that would translate into an actual clinical encounter.
I think we were all over the map with all of these, but lack of resources and expertise, the regulatory legal considerations, and some discussion around just how do you look at it through governance or some structured approach.
Anyone got anything else to add? Let's see how we voted.
Model accuracy, runaway winner. Pretty evenly distributed after that. That's the pre-event results. And here's the live. Model accuracy again. And we were discussing that this graph looks like a middle finger, like a big middle finger to AI. If you like these jokes, or if you don't, BJ wrote them.
Along with lack of resources of expertise, regulatory and legal definitely looks like our unknown group, along with our administrative leaders, really high on the model accuracy as well as regulatory and legal considerations. So we have gone through this exercise. We have one more question. We're not going to talk too much about the results, but we'd love to get your feedback on this one. And so we're going to flash right over here. And the question is, which operational data sets should be prioritized for efficiency analysis in a healthcare operations platform? We're not going to make you talk about this in your groups, but we'd love to get your answers. And in part, this actually helps inform our own priorities, as well as our roadmap, dare I say. And so we'd love to understand from you all. Clinical competency and learning opportunity and data, open rec and new hire data, patient quality, outcomes, payer contracts, networks, premium labor spends. There's a whole bunch up there. You tell us, just voting, which of these operational data sets should be prioritized for efficiency analysis. In other words, if you were looking for efficiency analysis, which ones would be the most important ones for you all to consider? And we're going to flash up the results as they're coming in so you all can see what you thought. Where do we stand before a few weeks ago?
Staffing and productivity, utilization, patient quality and outcomes, vendor contract and spend, all kind of in the top group. And now, similar layout. You guys are consistent, if nothing else. Staffing, productivity, utilization data, patient quality and outcome data. Let's see what else. Provider performance data, yeah. Staffing, productivity, and utilization data.
Anyone got any
Pretty
thoughts
low.
on this? Anything to add in?
Anybody want to comment on why that's number one?
I'm going to keep us
Bueller?
moving because we have absolutely gone through a ton of information over the past, I don't know, gosh, feels like 24 hours, but really it's only been probably 8, not even together. And as we move through this, I want you all to know that, oops, Todd, I'd love that clicker, that our conversations today have been informative, certainly for our symplr team, but for all of us on a number of different levels. And before we all leave today, I'd like to take a minute and I'd like to ask you, what were your aha moments? Was there anything? Was there anything you learned in the breakout sessions or heard from one of the panelists that was a little bit unique, or maybe even felt like, hey, actually, that kind of sounds like me, phew, we're having the same issues? Or, wow, that's a good takeaway, I'm going to try that. So we've got folks here with microphones. We'd love to hear from you. So what were your aha moments? Did you have any takeaways? While you're all thinking, I'll share one. I was in a breakout session with the operational leaders, and I'm going to pick on Terry because she shared an exercise her organization has just gone through recently around mapping out how they want to be thinking through some of the changes that we're seeing from a market perspective. Terry, you want to talk about that just for a hot second? Because I thought that was really interesting.
What we did is just anticipating the federal funding changes, particularly around Medicaid, the ACA, and increase in MA. We really took the exercise of what do we need to do from a system perspective to proactively anticipate the financial hit. What we know is that it's not going to cripple us, but it does require us to continue tightening our belt. So we actually did an analysis where we have 4 imperatives. We integrated that into our strategic planning, and we have tactical plans now for our next upcoming fiscal year to just work the plan so we stay proactive.
I love that. Any other aha moments? Maybe it's not even aha. Maybe it's just an kind of moment.
Well, it was a pretty simple thing. Sometimes it's amazing when you hear or people state the obvious and you still have that aha moment. So I did, because I was talking about value-based care and how I worked in at least 4 different states, and it's been an ongoing issue and it's not adapted. And of course, we had one of our speakers saying in Maryland, it's a requirement. And I'm like, wow, why couldn't we all other states do that? It's just if one state can make that a rule, why are we not adopting to it? Why can't we push for that? And I'm like, okay, maybe that is something that I would be working on to make those things happen. Because as we were talking about all the balancing finances, because we are so pushed by financial gains, all the number of patients that we need to see to make ourselves be more productive, as we said, all those things. If we have that focus on, again, value-based care, I mean, being more cost-effective and efficient, I think it will solve a lot of the issues that were discussed today. So I'm hoping that we can make at least that simple change which someone has done and make an impression slowly but gradually. Thank you.
I like that.
Hey guys, I have 3 things. I have something to think about, which is with Taylor Hamilton and being the consumer SVP. Something that I took away from Dr. Chowdhury that I will use to convince my CFO is invest to save. I think I'm going to use that line.
Invest to save. That's a good one.
And it's a 5-year timeline, guys. And then something I agree with Dr. Hassan, which is standardized to gain efficiency.
I like that. And your framework. Anyone else? Something you're taking away, something you agree with, something that challenged your thinking? Well, we had a really great conversation today with all of you. And I will say, on behalf of All of the people here from symplr, this is super important to us. It's a wonderful opportunity for us to hear from you, for us to connect, and we are so grateful that you all came. We're also pretty grateful for the folks at Becker's who allowed us and supported us through this whole experience and have been here helping us at this conference. We're incredibly grateful for a handful of amazing marketing people in this room who made this all possible. We've talked about Amy and Carrie throughout the day, but they have worked extremely hard, as have a lot of the folks that were on our panels and the people pulling this content together. So thank you for that, everybody. But most importantly, I want to thank you all for your time. As BJ said earlier today, we don't take that time lightly. It's really important that to us that you came, that you helped us think about this conversation with regards to healthcare and particularly operations. We think of healthcare operations as a category at symplr, and we're building it with you. And the way we think about it is informed by your opinions and what you tell us. And so this is incredibly important from that perspective. Of course, outcomes are a critical priority to everything we do. But to be honest, even above and beyond those outcomes is our partnerships and our partnerships with people, with you guys. So again, this stuff doesn't happen unless we sit around tables and we come to rooms and we eat popcorn and we spill popcorn and we connect and we talk, and it doesn't just stop here. We want it to continue. And so I would be remiss if I didn't call out the fact that we want these conversations to continue. And we'd love to ask, if it's right for you, to talk to you a little bit about how we can help, how symplr can make an impact in your organization, what you're doing from a strategy perspective, what that looks like for you all going forward. And so we'll be reaching out. Hopefully that's okay. If it's not, no worries. We're not going to be upset. But we would love the opportunity to talk a little more. And so thank you so much for being here, for giving your time, for being with us. This will not be our last conversation, I hope. Have a wonderful conference. Enjoy this time together. And with that, I'm going to send you all on your way. Thanks, everybody.